Good afternoon and welcome to United TV. Today is August 9th, 2024. This is our wellness webinar day from United Medical ACO. We have two panelists, Caroline Webber as usual, and also we're going to have Amanda Bostick, one of our nurse practitioners. She's going to be with me. I'm going to ask them to join me. All right. Good afternoon, everyone. So if we can do a quick intro before we start. Caroline, we can start with you.
Hi, I'm Caroline Webber. I'm one of the dietitians on staff United Medical. Also take part in helping to run the diabetes program and run the diabetes wellness webinars.
And I'm Amanda Bostick. I'm a family nurse practitioner. I work for United Medical Associates, and I am at the Bear location as well as the Wilmington location.
Stop being your name. All right, that's better. Okay, so today we are gonna talk about, again, diabetes, which what we do in these sessions mostly, and usually we kind of go with the different comorbidities, different illnesses that goes with diabetes and how we can control. But today we are going to actually take a step back and introduce what happens when someone is diagnosed with diabetes. So Amanda is going to help us to better understand from the clinical side, and Caroline is going to help us with the nutrition side of the treatment of diabetes.
Okay, so thank you for giving me this opportunity to talk about what I do on a pretty regular basis at work. So I have diabetes, now what? So this is what a typical first visit would look like with diabetes. Next slide, please. So just to start off with a few statistics here. Now, these statistics are from 2022. That was the last time that they were captured. So hopefully we'll have some new data next time I present. But approximately 38 million people 18 or older have the diagnosis of diabetes. And I think what's more kind of upsetting is that a lot of people are walking around undiagnosed. So about almost 9 million adults over 18 are undiagnosed with diabetes. And pre-diabetes, which I'll kind of get into in a couple of slides here, there's almost 100 million adults that had pre-diabetes. Next slide, please. So to just kind of talk about the different kinds of diabetes or types of diabetes that people have, because often I think this is one of the first questions is, what type I have. So type 1 is pretty rare, and that usually happens in children. However, it can happen in adulthood. It's typically an autoimmune response where the body actually attacks this that produce insulin in the pancreas. So you cannot live without insulin. Insulin is the catalyst that brings the sugar from the bloodstream to the cell so that it's like a key that opens up and provides the sugar into the cell of the body. So type 1 will always need insulin. Type 2 is an insulin resistance type diabetes. And that is where there's more blood sugar, there's more sugar in the blood, and the cell has then, the receptors on it have become resistant to the insulin that you have and all of the sugar. Pre-diabetes is kind of this window where we can hopefully capture people before they go into the range of diabetes. So pre-diabetes is just probably some of this insulin resistance is happening, but your blood sugar is typically, we measure either your blood sugar or your hemoglobin A1C. If your fasting blood sugar is between 100 to 125, that puts you in the pre-diabetic range. A hemoglobin A1C of 5.7 to 6.4 is pre-diabetes. A non-diabetic, just to kind of frame it all, is a hemoglobin A1C of about 4.5 to 5.5. Diabetes is technically, we've kind of gone over that threshold of the pre-diabetes, and a random blood sugar could be or more. A hemoglobin A1C is greater than 6.5. And those fasting blood sugars are 126 or above. So your clinician, when you come in for that first visit, may want some additional testing. Maybe you didn't get all of that testing done, and maybe you just had an elevated blood sugar. So some additional testing may have to happen before that actual first diagnosis of diabetes. Next slide, please. So some things that can complicate diabetes. The way I think about diabetes is the sugar molecule in the bloodstream isn't like a soft, fluffy cloud. It's actually a rather large molecule, and it's kind of spiky. So it causes, you can think about these big spiky molecules kind of working its way through your vascular system, how that could cause some inflammation. So some things that can actually not make the diabetes worse, but just compound the damage that it's doing inside of your vascular system would be untreated hypertension, certainly smoking, yet another compelling reason to quit smoking, elevated cholesterol, physical inactivity, and then having a larger BMI or a higher BMI. So some of these things we can control, right? So like smoking, we have you quit smoking. Hypertension, we do our best to try to get those numbers tightly controlled. Same with the cholesterol, and then get you a little bit more physically active. And hopefully with all of those, we'll see a decrease in the BMI. Next slide. So the goals when I'm meeting with a pre-diabetic patient or even a newly diagnosed diabetic is that I really want to get that person moving. What we know is that the muscles, the big muscles of our body actually don't need insulin to just pull the sugar out of our bloodstream. So if I could write a script, the first thing on the list besides, medication would be get moving. The more that you can move, and really looking at like moving throughout the day. So not sitting at a desk job all day and then going to the gym for 30 minutes. Really, I want to see some movement throughout the day. Or, maybe after breakfast, after lunch, after dinner, you're getting moving. And again, like letting your body just naturally, your muscles just obviously, like I had said before, we're going to try to manage the things that we can with medications. So if you weren't on medication before for blood pressure or cholesterol, because maybe you were just borderline, this definitely puts you in the category. Once you have diabetes, we really want to get those numbers under control. Vaccines that right out of the gate, if you're diabetic, we want to make sure that that your hepatitis B vaccine up to date. Well, either if we don't have documentation of that, we can draw titers and look at that through blood work and decide whether or not you need that. We want to definitely get that tetanus shot up to date. And then if you're eligible, to also get you a pneumonia shot, because having diabetes does put you higher risk of contracting these diseases. And of course, we would love for your COVID shot to be up to date. When I'm treating diabetes, the goal is to have that hemoglobin A1C, and the hemoglobin A1C looks at your sugar over the course of the last 3 months. So what we want to do is monitor that pretty closely every 3 to 4 months, and make sure that that's 7 or below. Ideally, if it's feasible, I want to get as close to like 6.5 as I can, because then I know that some of these complications, we're going to reduce your risk there. And then certainly, if we can work on some weight management strategies here. But if you are doing the physical activity and changing your nutrition, I'm sure that those things are going to kind of happen naturally. So then that's where we start bringing in more team members and bringing in my diabetic team to help my patients. Next slide, please. And so some of the first medications that we're going to use to treat diabetes, first line is typically metformin. And very recently, I was reading some articles by the American Diabetes Association, where they're actually, even when you're in the pre-diabetic range, encouraging clinicians to actually start metformin a little bit earlier. Metformin is a medication that helps to reduce your weight a little bit, and it can keeps the liver from additional sugar. So it will naturally just help to bring down those sugars. And in some cases, I've seen it really help with some of this insulin resistance in my patients. And then I'm sure we've all heard on the news about the GLP-1 medications. So that's going to be your Ozempic and the GLP-1, GIP, which is Mounjaro. There are a couple of other medications out on the market with different names. The way that medications work is that they send a message to the brain that you're full. It also slows down how quickly you digest food. And then it looks like it also works on the pancreas with helping it to release insulin. So all of that in combination, that we've seen a lot of weight loss with that. So some of the other is weight loss. Obviously, the lifestyle of increasing activity and then your nutrition component there. And depending on how high that blood sugar, that initial blood sugar 1C is, I will often start folks on insulin in the office at the first time. But again, if we're just in the pre-diabetic, or if we've got a lower hemoglobin A1C, we don't need to go immediately to the long-acting insulin. Next slide, please. So part of my team that I like to bring in is we're going to need an eye doctor to do an annual dilated eye exam to make sure that the back of the eye is healthy and that the blood flow to the eye is healthy. Again, think about those big sugar molecules and what they can do to the body. So again, those bigger molecules, they're going to really destroy some of our smaller blood vessels. So we really want to keep a close watch on those blood sugars and a close watch on those on the eye. Want to with your dentist on a regular basis. Podiatry, we pull in podiatry because one of the complications with diabetes is a loss of sensation in your feet, called neuropathy is the medical term for that. But it can be like a tingling sensation in the feet, or in some cases, in more severe cases, a loss of sensation in the feet. So bringing in podiatry, they're going to do an excellent foot exam and make sure that your feet are healthy. And you would go at least annually for that. Of course, get you in with a registered dietitian, who's next on the agenda here. Bring in an endocrinologist. Sometimes if we're having trouble getting that hemoglobin A1C under control, sometimes I'll bring in the endocrinologist. A nephrologist is a kidney doctor. And so oftentimes with diabetes, one of the mechanisms in our body is that if our blood sugar reaches a certain threshold, our body tries to spill that or take that sugar out of our bloodstream and put it in our urine to try to offload it, to try to get and correct our blood sugar. And you can imagine that those large molecules can be very damaging to the kidneys. So we're going to be keeping a close eye on those kidneys. And then if we need a referral to a nephrologist, that would be something to consider, as well as a cardiologist. You've heard me talk about cardiovascular implications with having diabetes. And again, if we see that there's a need to get you to a cardiologist because of diabetes, that might also be an excellent person to bring in.
Good afternoon and welcome to United TV. My name is Kemal Erkan. Today is September 13th, 2024. Our clinical presentation, I'm going to be joining Dr. Carlo Valencia and our program manager, Caroline Webber, are going to be with me. Guys, you can turn your cameras on right now. Today, we are going to talk about managing diabetes in older adults. Managing diabetes in older adults presents unique challenges due to the natural aging process and the presence of the other chronic conditions. As people age, the risk of complications are also increasing, and therefore it's requiring a very close close-up management, so that these individuals are not ending up in the critical conditions. And our goal today is to provide some guidance for those who are looking for additional support. And Dr. Valencia, who's also my primary care as well, is gonna give the presentation, and Caroline is gonna support us with the nutrition part of this. So, Dr. Valencia, if you would like to introduce yourself, please feel free.
Yeah, so again, thank you for having me. My name is Dr. Carlo Valencia. I'm one of the primary care physicians of United Medical Clinic. I've been with the practice for about 12 years now, and I'm happy to be here.
And Caroline?
I am Caroline Webber. I'm one of the dietitians on staff for United Medical, also the program manager for the Diabetes and Nutrition program.
All right, so we can go ahead and start with the PowerPoint.
All right, next slide. All right, so like Kemal mentioned earlier, so the diabetes in elderly can be challenging. It remains prevalent in the elderly populations. In fact, 25% of people over 65 in the United States and half of older adults have actually pre-diabetes. They do present similar microvascular complications like diabetic retinopathy, nephropathy, neuropathy, and they may even actually have a higher risk of macrovascular complications. So these are heart attack, CAD, peripheral artery disease, and stroke. So it's important to take care of these patients still. Next slide. And then like Kemal mentioned earlier, they can be challenging in taking care of these patients because of multiple factors, which includes polypharmacy or use of different or multiple medications that can have certain interactions and increase side effects. And you also have to consider certain things like cognitive impairment, which may range from mild cognitive dysfunction to severe dementia. And these types of conditions can definitely impact patients' self-care management in terms of their diabetes. So sometimes these types of patients may have difficulty with checking their sugar or using their insulin pens. So that's an important factor that we have to consider. Depression is also another thing that we have to consider. So sometimes patients with depression, they can overeat or they can undereat. So that can definitely impact the glycemic control of these patients. And other factors to consider, urinary incontinence, and then these patients are also at risk for falls and frailty. Next slide, please. So goals of care. So how do we take care of these patients? So I've subdivided them to 5 different sections. So mainly we try to control the hyperglycemia. Secondly, on the other end of the spectrum, we do try to avoid hypoglycemia in these patients as well. Obviously, we have to think about the other cardiovascular risk, screening for microvascular complications, and then lifestyle modifications are still important as well. So for the first section, mainly regarding the hyperglycemia, there are 3 main groups that we have to consider for these patients. The first group are the healthy adult patients. So these are patients with few chronic illnesses with intact cognitive function. So these patients, you expect them to have a longer life expectancy, like more than 10 years. We are aware that the glycemic control of less than 7.04 for most patients, but For these types of patients, we do give them a little of a leeway. Less than 7.5% is the goal, with a fasting glucose goal of 90 to 130 and a bedtime glucose goal of 90 to 150. So second group that we have to consider, so these are patients, are complex patients. So patients with arthritis, cancer, congestive heart failure, depression, patients with like incontinence, emphysema, chronic kidney disease, and other comorbidities, or patients with like mild to moderate cognitive impairment. So these are patients with, we do have a lesser goal, like less than 8%. So these are patients that are expected to live like 5 to 10 years. And then the same thing with a fasting glucose goal, it's a little bit higher at 90 to 150, and then bedtime glucose goal of 100 to 180. And then the third group, so these are patients are very, very ill, patients with end-stage chronic illnesses. So examples of which, patients with stage 3 to 4 congestive heart failure and stage COPD, patients with metastatic cancer. So these types of patients, we were looking at like life expectancy of a couple months. And for these patients, the goal of the A1C for these patients are even higher, less than 8.5%. With the fasting glucose goal of 100 to 180, and then the bedtime glucose goal of 110 to 200.
Thank you. So we're going to talk about diabetes-friendly meals in 30 minutes or less, 30-minute preparation time or less. Mostly because a lot of the time with aging patients, we see either decreased mobility, not being able to stand for long periods of time, needing easy recipes, finding places to save time, valuable time that you might be busy with a different schedule, but this can definitely be applied to all ages. So we want to make sure that we're maximizing nutrient content, we're balancing blood sugar, but also tapping into interesting flavors. It doesn't have to be boring. We can use certain convenience foods that we'll talk about to help make meal prepping a little bit easier. Cooking quickly doesn't mean it has to be the same meal every single night. We can find lower cost options that take minimum time, but do offer maximum nutrients to keep your blood sugar stable and keep you fuller longer. So I love this first recipe. This is quick salmon burgers. So really low cost because we're using canned salmon, which can actually be pretty flavorful if you kind of mess with the different flavorings. You can feel free to customize. If you like dill, if you like lemon, if you like parsley, you can feel free to add whatever flavorings you want here. This one has a total of 3 grams of carbohydrates. So it's really great to add a side to, right? If you wanted to add a little bit more carbohydrates, we could add a couple of new potatoes. We could add a side salad if we're going a low carb density meal. We want to make sure that we, over the next couple recipes, cover some main options, but also some side and dessert options that help give us a well-rounded meal, but also meet that, satisfaction that we have, some savory, some sweet, making sure we include different varieties of types of foods. This recipe is really great because it's quick, right? The salmon's pretty much already prepared. You mix things together, you bake it. It's a great option if you're looking to include fish in your diet on a budget and with time sensitive where you don't have to feel like you have to spend all this time seasoning it to get it just right. So quick salmon burgers, great for a weeknight meal, really quickly, easily prepared, and a great protein source as well. This is also really nice because this one can act as a side or it can act as a main option, the Moroccan couscous with chickpeas. If you want to throw in some vegetarian dishes, which I really always recommend trying out because they usually are rich in fiber and very low cost and easy to prepare. You don't have to spend a whole lot of time cooking or roasting or basting things or even marinating for that part. So we want to make sure we have some different varieties going on with protein sources and different vegetables we're including. That can also make your life a little easier. This one really increases the fiber with a lower fat density, which is really nice. But it's also something you could change around a bit. You could add different kinds of vegetables that you like. This one's pictured with carrots and peppers. If you wanted some celery, if you wanted some broccoli thrown in there, you can really customize it per your preference. My only recommendation for this recipe would be maybe add some different beans or more beans. If you double the bean of the recipe, you get more bang for your buck. So you can kind of stretch that meal. You can have leftovers. This would be one that would be really great flavor-wise on the next day. We also have couscous as our carbohydrate source. So this is where you can kind of pick and choose what you want your couscous or your carbohydrate to be. White couscous has a lower carb density and a lower fiber content. It also has lower calories, but those numbers don't necessarily mean a whole lot when you compare it to the whole grain option of couscous. The whole grain option is higher in calorie, a little bit higher in carb, but it's got tons of fiber. So you're getting a slower digestion of that grain. And it might keep you full a little bit longer as well. So you can kind of pick and choose what is important to you priority wise. If you like the taste of something better, you can get fiber, elsewhere through your vegetables if you prefer the white couscous. So we want to make sure that we also are looking at the full nutrition profiles for every food, not just labeling something as good or bad, right? Each thing has an important factor about it, whether it's fiber or protein or satisfaction for that matter. So be sure to look for ways you can customize your recipes. Vegetarian options are great. They're usually lower cost and quicker to prepare. This chicken stir fry with veggies is a great one, especially if you're looking to lower the carb density total. If you're having trouble and you're really fickle with your blood sugars and you really just can't afford to have any carbohydrate in that mealtime, this one's a great one, especially if you have leftover things you need to use. You could throw in any vegetable that you prefer, and you can really change around the protein option. Do beef, you could do beans, you could do tofu, you could do chicken, whatever your preferences is, you could change around this recipe. But vice versa, if you wanted something a little bit more filling, or you're feeding a large group of people, or you just want something to last a little bit longer so you can eat some leftovers, try adding fiber-filled grains to it. A complex carb like quinoa or whole grain rice or farro would go really well with this. That would help you stretch it. It would also keep you fuller longer, but it's perfectly okay if you're kind of just using a lower carb density, focusing on those high fiber veggies and protein options. A lot of the time, patients kind of get burnt out on trying to find meals that work for them and their families, finding something quick and good and not the same thing every night. So we want to include a variety of flavors. And I think these turkey burritos are really a great way to do that because you can expand, flavors to spicy or savory. And you can pack a lot of punch in a small amount. So you could flavor the beans or you could flavor the protein and have that kind of spill over to whatever you're mixing it with, whether that be vegetables or rice or anything like that. You could also alter this into a salad, right? If you don't want the carbohydrate, or maybe you're not a big fan of burritos, you could throw it on top of a salad for a lower carb dense, maybe throw in extra beans for a little bit of more fiber, for starchiness. But you could also kind of use this as leftovers. This is a great thing to have leftover filling that you would end up using later on in the week. So the goal is one pot meals if we can. Keep it fast, keep it easy preparation. You can even use, convenience foods like frozen and canned vegetables here. They're equally nutritious. Obviously, with canned, we want to make sure we rinse that off if we're watching our sodium, but you can get just as much fiber, just as much vitamin and minerals from those canned and frozen options. And they might be a little more cost effective as well, especially if you don't end up using all of that produce in the fridge, if it's more likely to go bad, or if you're just not in that place to spend time cutting and chopping things, right? Having beans and already chopped up tomatoes and corn, having that already there and present and prepped for you is really helpful if you're trying to limit time. This one is great, especially for some new flavors as well. So a warm Asian beef salad, where it offers you some different flavor profiles, but also a really great way to customize what you want in a salad, right? You could change the vegetables, you could use those canned, frozen, fresh vegetables if you want to. If you're not a beef fan, you could change it to chicken, or you could even, use some type of bean or lentil if you're going the vegetarian route. We also don't want to encourage skipping on the dressing either, because the dressing plays a really important role. It offers a fat source. Fat sources help to slow down the digestion just as fiber or protein would to give you a better balance of your blood sugar, but it's also going to increase the absorption of your vitamins and minerals found in those fat-soluble vitamins in those vegetables. So having a good source of fat, a good source of protein, a good source of fiber, and stacking that on top of your carbohydrate is really going to give you the best benefit. something I would love to add to the salad, maybe be some like mandarin oranges or something like that to give you a little bit of sweetness, a little bit of carbohydrate in there, but still a good fiber source to support your meal overall. And here's like a nice side that I think is great to include, especially we're out of summer almost, but having some squash or zucchini or any vegetable really and roasting that. You can also find a great deal on like frozen cauliflower or frozen broccoli where you could do the exact same thing you're doing with the zucchini or squash and not have to cut it up. So you could just dump an entire bag full of frozen cauliflower, cover it with a little bit of olive oil and your seasonings, and that could be a great supportive side for whatever you're having for your meal. So it's a limited lower density carbohydrate, but you could stack a protein on top of it. And it's just a great addition to have to increase vegetable consumption, but also to balance your blood sugars. And I'm a dessert person, so I always love to throw a dessert anywhere I can. And it is possible to enjoy, sweet things, but also manage your blood sugar. There's just a way that we do it well. And that's making sure, one, we have a great supportive meal, right? We've got protein, we've got fiber, we've got some fat in there to slow down digestion. But we also want to take into account the portion size of our dessert, right? And the frequency of how much we have. So allowing that spreading out of the carbohydrate intake is very helpful. But there are options for elevating the protein in a dessert, right? So this blueberry chantilly is great because you've got high fiber fruit. Usually the fruit is a lower sugar density. So you've got those berries that usually are on the lower side of the sugar compared to other fruits. And you've got some cream cheese. You could even play around a little bit with higher protein dairy like ricotta or even Greek yogurt. There's a great Greek yogurt cheesecake dip out there with sugar-free cheesecake jello mixed with Greek yogurt and whipped cream. Fantastic. So there are workarounds for dessert if you want to balance the blood sugar and have a little bit of a larger portion size on occasion. But more so, we just try to keep the portion size small. Obviously, allowing yourself permission to eat dessert when the time comes, like if you're with family or it's a celebration or when you really just want to enjoy something sweet, giving yourself permission allows us not to have that restrictive nature with sugar where that tends to have us overeat, right? So allowing us to have regular, frequent intake if we want in small portions, but also making sure that we're balancing our other meals because that matters just as much as if we're including a dessert and trying to balance our blood sugar through that as well. So with that, we want to kind of touch on how do I build, a meal to balance my blood sugar? Basically, all of these meals had a common theme: protein, carb, fat, and some fiber thrown into there because when you stack them on top of each other and create a well-balanced meal, your blood sugar is very happy because we're slowing the digestion and breakdown of that carbohydrate, which means a slower rise in blood sugar. We also want to make sure, our goal is to add some different varieties, right? Fruits, vegetables, lean proteins. The nutrient content matters. So we're supporting your nutrition status with all of those things, which is especially important as we age, right? We can easily be deficient in things, not eat as frequently, have different hunger cues. So we want to make sure we have really good nutrient dense foods because the more density we have, usually better blood sugar control because we're kind of pairing things together. We want to make sure you're also staying fuller for longer because that means we're less snacky, less, a little smaller portion sizes throughout the day, which supports good blood sugar as well. So I like to break it down into really easy steps of find your protein, choose your veggie, ask yourself what carb do I want if I want any, and can you add more fiber? We're always looking to see what can we add to a meal rather than what can we take away.